So this will be the second lecture, and in this lecture, we will be discussing about your different types of letter, such as referral letter, discharge letter, update, request letter, transfer letter, and so on. With reference to the first type of referral letter, that is a kind of letter when we have the assessment or diagnosis is being given, right? When you have the assessment and diagnosis being given, let's say, if you can see, thank you for seeing Mr. Mark, a 28-year-old accountant who has sign symptoms suggestive of, let's say, diabetes. So we can write it down, right? So we can just write down the diagnosis as it is over here, right? So we have to see if we have the assessment or diagnosis being given, we can write it down as it is in a letter of referral, right? Okay. So after that, we have a letter of diagnosis. Let's say without diagnosis, we just have the symptoms. If we have the symptoms without diagnosis, such as you can say investigation result revealed blood sugar level, there was a 3 month history of lethargy and the blurred VN. So rather than writing or making the diagnosis ourselves, we can just rephrase into a lecture. Let's say decreased VN. So you can write, thank you for seeing Mr. Alex, who presented with 3 week history of lethargy, decreased VN, and recent blood investigation showed high blood sugar values, right? So we can just write down the information that is being given to you as a symptom in the introduction part. After that, we have a differential diagnosis. In the differential diagnosis, either we have a primary issue, such as, this early bowel obstruction, secondary, like so due to diverticulitis or carcinoma, right? We can have this issue. Okay. So we have, let's say, IBD. We can write it down either Crohn's or ulcerative colitis. We have AMI, like two different differentials. We can write it down in different approaches. So now you can see there, the differential diagnosis can be written in this way. I'm writing to refer Mr. Alex, whose sign and symptom are suggestive of an early bowel obstruction, secondary to diverticulitis or carcinoma, or we can also write it down, let's say, another differential letter, different diseases. Thank you for seeing Mr. Alex, whose features are suggestive of acute pulmonary edema or acute myocardial infarction for further arrangement. Then we can see there, I'm writing to refer Mr. James, who has a differential diagnosis of bipolar disorder, depression, or schizophrenia for a definite diagnosis and further management. Right? So these are differential diagnoses that can be written over here in different approaches. So as you can see that there are 3 different lecture of referral: without diagnosis, with diagnosis, and differential diagnosis, right? So before we can move on, there is some question the candidates are asking, so we can answer them. Let's say a letter of discharge. Letter of discharge, basically the concept is the follow-up. So as we will be discussing this letter of discharge with you, normally in a medicine letter, social history, family history, and past medical history is not relevant, right? So this is just a sketch diagram I've drawn for you. So that you can better understand. We may have the ward history, we have the rehabilitation detail, and we have the discharge plan, right? So we should not write down, let's say, something in expansion in the ward stay. As you can see, there might be a lot of information in the ward stay. You need to summarize it down. You can follow the chronic sequence, like the sequence of event. Then the rehab stay should be summarized. And the discharge plan, you need to expand the discharge plan, right? Is it clear to you? So after that, we can see there, in this letter of discharge, if you can see normally, there are a lot of information being written in the ward stay, then followed by rehabilitation and discharge. So you should just follow the sketch to write your letter of discharge. An introduction can be written this way. I'm writing letter of discharge regarding Mr. James, who has undergone a successful right knee replacement surgery and is being discharged today for follow-up. Right? And is being discharged today for further follow-up. Okay. So after that, we have letter of request. In the letter of request, we may write it down to the, let's say, to the occupational therapist. Let's say we can write it down to the physiotherapist. We can write it down to the social worker. We can write it down, let's say, for the eligibility of pension, letter for home placement, for genetic review, and so on. Right? So if you can see that, first of all, we need to understand what is the role of occupational therapist, what is the job requirement of occupational therapist. So first of all, it is the job of occupational therapist, to go for the hazard assessment, either at workplace or at home, right? We need to go for the hazard assessment at workplace or at home. Such as, if you're writing letter to the occupational therapist for the home assessment, the occupational therapist will come there and he will assess the hazard. At home, he would also help the patient to have assistive devices and so on. Similarly, for the workplace assessment, it is a job of occupational therapist to have the hazard assessment, let's say. Okay. And we can see there that he will go to the workplace and assess the workplace of the patient as per the requirement. Okay. As per the requirement of the workplace, as per the medical condition of the patient. Right? Okay. After that, we have the letter to a social worker. If we are writing this letter to a social worker is the known technical person, right? Social worker will also help the patient to assess, the patient socioeconomic aspect, so that this can be, you can say, help the patient to have the normal life or transition back to the normal level, right? Then we can also see the letter of written to the, let's say, for the pension care, right? So in case when we are writing a letter for the eligibility of pension care, let's say if there is a patient who is a veteran, and we are writing this letter to the Department of Veteran Affairs, right? We are writing this letter to the Department of Veteran Affairs. Then it's a kind of letter, let's say, that can be written over here. It's a kind of request so that we can evaluate the patient. We can say patient financial status so that he can be eligible for the pension. Then followed by letter for home placement. In case if you are writing for the home placement, like we need a person who can help the patient for the, you can say, let's say activity of daily living, right? For the household chores. So this is the reason we are writing this letter of, you can say, home placement, right? Okay. So now we can see it can be in a category of referral or discharge. So we can simply write it down in this way. I'm writing to request you regarding Mr. James' workplace assessment, who has been recovering after a successful writing replacement and want to resume his job. Now this is your letter of request. Now we also have a letter of transfer. Normally in a letter of transfer, the transport is involved. I'm just using different terms to make you understand if they use those terms. However, the letter of transfer can be considered as a at time letter of referral if it's in the category of referral. At time it can be the category of discharge if it's in the category of discharge. So what we can see is like from the periphery. Okay. So basically, from low to high stream, from side to mainstream, let's say field to the from field to the hospital, from ward to the emergency, like departmental transfer. Okay. So we can see, first of all, it's your, you can say, transfer to from emergency to ward and from ward to emergency. Let's say it also kind of transfer letter or maybe the referral letter as well, or the short back also can be considered as a transfer letter. We are also seeing sometime in the case note one-way transfer. Now, one-way transfer mean like transfer to hospice care when there is no coming back, or transfer to the facility, at least then in a short period of time, there is no coming back, such as same specialty referral, which includes your GP to GP referral as well. So we can simply use the word like I'm transferring Mr. XYZ who need your space in your hospice care as is on the terminal state of cancer. So now you can see that we can edit down the letter of transfer using those lines to make it more clear, right? So we can have education letter. In letter of education, it's less likely that we can expect in the medicine, but still we can have this letter of education. For example, when we have a outbreak of some disease, so we can write it down, the letter of education. Let's say outbreak of chickenpox, COVID-19, let's say definition, prevention, treatment, and so on, right? These are some of the diseases, okay? So these are the letter of education, let's say from definition, from prevention, from treatment, okay? So we can see there, these are types of letter and followed by the information letter. In the information letter, the general practitioner will be writing to the health ministry most of the time. Any person from any domain can be writing this letter to the health ministry to update about new disease or to request about some to update about existing facility or any services that is being required in the community, right? So these are the different type of letter that we have discussed with you. Before we can move on, if you like to ask any question, please feel free to ask me.